Hi Patrick, thank you so much for joining us on the Building a Brighter Future
No, pleasure.
podcast. So can you just tell us a little bit about who you are,
Sure.
what your role is and how it's involved in social value?
Yeah, no problem at all. So I'm Patrick Vernon. I'm the chair of NHS Birmingham and Solihull Integrated Care Board. Integrated Care Boards, about 42 of them around the country. You've probably heard of lots of changes in the NHS, so in the future there may be less, but currently we commission healthcare for the population of Birmingham and Solihull. Population is roughly about 1.4 million, and we spend about £6 billion a year where we basically fund and commission hospitals, all the hospitals, so the mental health services, specialist services to do with children and women, joint commissioning with local authority as well. So and obviously we have a lot of staff. So staff working and also primary care and GPs. So our job is to commission. We work with 5 NHS provider organisations who do the delivery in Birmingham and Solihull. So our work is money, strategy and policy, as well as some key functions and report. My role is to report upwards to government on how we spend the money, performance and delivery of our providers, delivering healthcare as well. And in that context, obviously, we also fund and commission voluntary sector organisations as well.
Fantastic, good. We'll get into that
Yeah, sure.
definitely.
Yes.
So you say you report up to government.
Yes.
The government's Procurement Act 2023
Yes.
has just come into being implemented.
Yes.
What kind of changes can we expect to see, or what are we already seeing?
I think there's already green shoots already. I think the Act sort of confirms some practice that's happening already. So definitely for us, as the NHS in Birmingham and Solihull, even before the Act came into fruition, we started planning and what we've done, we're one of the very few health systems in the country where we've pulled all our buying power together. And that's been led by Simon Clark, he's head of shopping. And so we spend roughly about £2 billion, we call it non-pay. So anything that's not clinical or core services, non-pay. So that would cover IT, beds, transport, etc., and lots of ancillary stuff that supports delivery of all our services. So we're one of the very few like NHS organisations to have a team that manages that whole procurement contract for everyone on behalf of the NHS in Birmingham and Solihull. So because we've done that, we have seen the opportunities of looking at how we can max and further develop the money that we spend with our suppliers and contractors as well.
Great. And so you mentioned some green shoots. Have you got any examples?
Yeah, so we as at board level, we've been talking about this for a little while because we have 4 objectives as Integrated Care Board, and our 4th objective is around sort of health inequalities and sort of economics and well-being. So as we started, when we were first established in 2022 as the ICB, we obviously had to get the basics, our governance right, our strategies. We developed a 10-year health strategy for Birmingham and Solihull, and lots of things we've put in place. And then after we developed the strategy, we realised actually we've got to do more work on our 4th objective. So we had probably about 18 months ago, we had a board seminar to explore the whole issue of social value. So we had Simon Clark and other colleagues kicked around some ideas and then said, well, we need to kind of pull it together. What can we do? We saw what Birmingham and Solihull local authority, they've been doing social value for a number of years, and they've got systems in place. So they did a presentation about what they've done, some examples of how they've used social value in their procurement process. So we thought, well, we can adopt that actually as well. So, and then we had a conference probably about a year ago now, which obviously you were there. I think that's where I first met you actually. I can't believe it's that long actually, isn't it?
Yeah.
And so we've started the process already. And part of that conference that we did, as part of the Plan Lot conference, which was well attended, we had over 120 or 30 suppliers, some of them multinational companies, and we tried to do a kind of a sort of speed dating session to bring together the suppliers and the community organisations as well, with presentations done by a number of organisations about what they do, so the companies that were in that conference can actually get a sense of the potentiality of that. And since then, we've adopted the web portal to try and encourage the corporates to make an offer and encourage third sector organisations to say this we're available. And Simon Clark, what Simon's been doing, he's just been going and visiting lots of organisations, trying to sell the idea to get on board onto the portal, as well as working with the corporates to see where, some of them have already started to make offers around employment, training as well. So it's still early days, but I think we're moving definitely in the right direction.
Great. And why is it so important? Why in this area in particular does it matter to our communities?
Three main reasons, I think. Firstly, everyone's a taxpayer. So, we have a fiduciary responsibility in terms of NHS, in terms of how we spend our money. And obviously we are spending lots of money on contracts, whole range of contracts and working with different businesses. And the businesses are doing very well nicely out of us. So we think that if we're giving you contracts and you're doing quite well and it looks good for your shareholders, you could do something for the community. You can invest some of that money that we've given you back into the community as well. Secondly, I think it's about, I've been having lots of conversations with Richard Parker, the Mayor of the Combined Authority, and he's got his ambition around sort of growth for the West Midlands in terms of housing, employment, transport, and I think the NHS could contribute to that agenda around economic growth. People often see the NHS as a disease service, and predominantly we are dealing with big issues around coronary heart disease, cancer, whole stuff around A&E, mental health and stuff like that. But also we own a lot of estates. Our workforce is immense. I mean, if you add all the staff that work across the NHS in Birmingham and Solihull, from primary care to the hospitals to community services, you're talking about just under 100,000 people. So we're probably one of the biggest employers, if not in the region. So we've got that leverage around workforce, we've got that leverage as well. And I think the third thing is about how it contributes to our agendas at NHS, tackling health inequalities. People in poverty, people who don't have access to the types of life chances they have. And I think we can make it, and I think social value can contribute to that.
Definitely. Yeah, they're all really, really important points. And your third point about the impact on the community, the health gap, the lifespan gap between the richest and poorest is shocking in this area. So,
it is shocking. I mean, the average life expectancy from the rich to poor parts of Birmingham, Solihull, leafy Solihull to Sparkhill, Sparkbrook, Newtown, it's about 10 years. And we know that's not acceptable. So that's part of that. We know that Birmingham is a global majority city. I was at an event last week where so the NHS is part of Birmingham City Partnership, which has lots of organisations working with to look at the vision of Birmingham, and launched strategy last week. And one of the key aspects of the strategy, which is quite aspirational, is that recognising the diversity of Birmingham. It's a young population, youngest population in Europe, and we're a global majority population. So this is also an added factor as well. I think social value could contribute to the equality diversity agenda. It may not be popular in other parts of the world, but it's still a key thing here in Britain. And I think social value could contribute towards that too.
And that's amazing to hear, because it's a tough environment out there.
Absolutely.
Lots of organisations that are UK based but perhaps have a link to the US are rowing back, being less vocal about their diversity.
I mean, Sadiq Khan, you probably heard recently, he's in some of the contracts he's awarding, and if any contractor is not adhering to EDI, he's not going to give them the contract. He's made it very clear and explicit, and I think that's quite bold. And so, so I think it's engaging with the corporates, and to say, actually, this is part of your core business. It's not a fringe activity. It's not being woke. It's actually business sense, basically. And all the research work that's been done for many years, say if you have a diverse workforce, if you engage with communities, it improves your bottom line.
Yeah, absolutely. There's scores of studies out there that prove that. How does procurement really shift the dial on this issue?
Yeah, it's doing things at a larger scale. So as I thought, we've pulled together or are buying from individual trust organisations. There are about 5 NHS trust organisations working in Birmingham, and some of them, and also primary care as well, because GPs, they do their own buying as well. So we've brought a lot of that together, which means that it's about £2 billion. That is a lot of money. That is leverage that we can plan ahead around some of our contracting, avoid duplication, save money in terms of tax efficiency for the taxpayer, and also we can actually work with some of the bigger companies and say, well, if you want this slice of the pie, and you demonstrate to us, and actually we're probably one of the very few systems to say, in terms of when organisations go for that procurement process, that contracting process, in terms of our weighting, we've actually upped it to 20%, which means that they've got to demonstrate, if they want to have business with us, they've got to have a significant evidence or potentiality that they're going to make that difference, as opposed to them having a contract and they may or may not do something, basically. And if it's in a contract, it's binding. They can't walk away from it.
That's great to hear. That is great to hear, because it's so important to be transparent about expectations for those corporates, so that they know it's just a normal cost of doing business. You can't just say, we'll do something and then never deliver on it. But also, I think what your words allude to is the difference it's going to make. It's not just the activity, what are the outcomes? So, you know, giving away some of your, what is actually business waste to a charity organisation, that might be helpful for them. But actually, if you are saving money on not sending that waste to landfill, and it's helping you with your environmental impact, then actually you should be paying that charity to take that waste off you. So if you're an organisation that perhaps does laundry, and you get lots of extra items within that laundry that actually shouldn't be coming back to you, then it's only natural that you should donate them to a homeless charity. But that is trash. That is rubbish to you, and for you to get rid of it, you should be paying that organisation to get rid of it. Yes, it is of value. Also, it's just looking at what is the outcome. How much difference, in other words, does that make to that homeless community? And actually, yes, that's really helpful, but what moves the dial for that community to have the long-term impact? I think that's really important to start to shift. It's great that the Procurement Act is there, and we've now got this framework in place to really look at, yes, we're employing local people, that's fantastic, and we should be commended for that. Yes, we're getting apprenticeships in place, that's brilliant, because actually that for that small number of apprentices, that could be really life-changing for them, and especially if it's in the NHS or the supply chain, that's probably a long-term career, and it could completely change the trajectory of their life. But with the other social value work, we need to kind of shift to make sure that it's actually delivering long-term outcomes for the community. I think what I'm seeing at the moment in the shift is a lot of the funding is going to the social value team. So you've got a social value manager nationally, a regional social value manager, and then the social value officers. And actually a huge amount of that funding, of that contract that has been put forward, is going to paying those wages.
I'm with you,
And then there's perhaps £5,000 or £10,000.
You mean like a trickle down?
That is for the whole year. That is, the majority of that is going towards funding events. Or, you know, some additional costs for those apprentices. Actually, you know, perhaps that's £50,000 or £100,000 that actually could be truly transformational for the communities that we're talking about. So, you know, what are those projects or those programs that are really moving a dial to change that 10-year lifespan between the people from lowest income neighbourhoods to the highest income neighbourhoods? And are these things that are being put forward in those contracts, are they actually going to be addressing?
I think it will do a long term. It's, you know, it's not that straightforward, because the complexity of people's lives and the nature of how we do healthcare and how we work in partnership with not just the corporates, but also with local government. It's a team effort. It's a partnership effort. I mentioned about Birmingham City Partnership, which we're one of the members of. There's about 22 partners. And it's about how all the partners in Birmingham particularly work together from the corporate side to voluntary sector, NHS, police, the arts sector, etc. Because that's the only way you can have that kind of effective intervention. So all we can do from the NHS family is to use our money slightly differently, try and see what more can we do to fund the third sector. There's a massive third sector infrastructure in Birmingham, and we essentially, even though we have our own separate funding stream that we've funded third sector organisations, it's not enough. We get oversubscribed 10 times over, and that's one of the advantages of the social value, because we've spent that money already. We're just trying to get corporates to join us, to be part of that opportunity. And actually, I think the social value concept should be adopted universally in Birmingham. So it's not just the NHS doing its bit, it's actually how you combine the buying power of the public services, and that, and that would double the money, and that would put us in a very influential, powerful situation. Because again, Birmingham's got its own ambitions for growth. The West Midlands Combined Authority has got its ambitions for growth, as well as Solihull, our partner as well. So I think it's about how you harness that, but it's not straightforward because everyone's still got the rules and regulations. The NHS procurement process can be challenging, put it mildly. And so we have, but we're trying to influence the national policy within the NHS to what more it can do, basically. And I think there's lots of changes taking afoot happening around the NHS, and who knows, that might give us a bit more flexibility to do stuff as well. Still got a long way to go. This is a journey, and we're still, I think for us as an ICB, we've just literally just got off the starter blocks. We've just got to now keep that energy going and not flag short of the finishing line, if you know what I mean.
Yeah, definitely, and I absolutely agree. I mean, the Procurement Act says 2023, but it only came into implementation in February 2025. So
yes,
we're literally right at the beginning.
Yes.
And it is that journey, and the ICB locally is definitely ahead of the curve.
Yeah.
I hear there's some national awards.
Yeah, I mean, I have to give credit to Simon Clark and the team. We've all worked together. Obviously, as a chair, my job is to approve and say, good idea. But I've actually got involved working with Simon and colleagues, and I've visited some of the organisations and what we're trying to do. So I think it's about myself and David Melbourne, the Chief Executive. We're trying to create that cultural environment of leadership to say, we think this is important. We believe that this adds value to our work as an NHS. We believe that this could contribute to our agenda around social justice and health inequalities. And so we've created that, we've given that permission to do this stuff, so, and we want to be, I think if you look, in terms of us as an ICB, we're probably one of the best performing as ICBs in the Midlands. We're quite cheap in our running costs. I think there's a perception that ICBs seem to be spending loads of money, but no, we're very conscious of that. And also we've got a clear agenda around health inequalities, racial justice, and all the protected characteristics. And that's straight from our board. That's what I firmly believe in, and that's what we're trying to do. Great.
And it's fantastic to hear that. So what's your message to corporates who are perhaps in that tendering process?
Sure. Three, four messages. Talk to us. Even before you're not even quite sure, even before you might have received a prospectus to put in your bid, just talk to us, explore, we've got lots of data and information that we can share. You can meet organisations, obviously register on the portal, but have an open mind, and also just to recognise that we're working in partnership together. Obviously there's a clear contractual obligation around the delivery of whatever contracts you've been awarded, but also it's equally a partnership. We want, it's not just simply money. You've got other intangible, in-kind support you can provide, and some of you are doing that already. And let's work together on that, because we have there's a vested interest for you. Because if you support us, we will support you too.
Brilliant. And you mentioned working with voluntary sector organisations. Can you share anything that could help voluntary sector organisations move into that public sector?
Yeah, I think at the conference there were a number of organisations, even though they said we're willing to want to engage, there's a degree of cynicism. Sometimes I think that corporates are there to be done to on them, without engaging with them. So I just say that register on the portal, talk to us, talk to the team, Simon Clark and his team, and to again how we can work with you and support you, and also it's about how you do your. I mean, I think your organisation, what you do, you have a clarity. You know what social value is. You are successful in doing, and I think it's like people like yourself and others can help voluntary sector organisations to clarify exactly what you want from a corporate, exactly what pitch you're going to make. And be clear about it. Not and you can't have the whole world immediately, but what things is immediate to you, and what kind of experience can you offer the corporates themselves so they can understand your world, be in your shoes for a while as well.
Great, and that's really important actually, because you talk about you visiting some of these projects.
Yes.
Can you tell us maybe about one of those visits and the impact that it had on you?
Yeah, I've been to different community. I mean, part of my job as chair, I'm out. I mean, like yesterday. I was down Hippodrome. We've got a cancer bus, so we're trying to do a lot of cancer work. We've got one of the worst cancer rates in the country.
Oh, really?
In terms of all aspects of cancer: breast cancer, lung cancer, liver, prostate cancer, all the cancers you could think of. So we're trying to encourage the public to take a greater responsibility around their health, well-being. Not everyone's going to their practices, GP practices, because sometimes it's difficult. People might not want to go, but what we do, we go into shopping centres and streets, and we've got health professionals and doctors and volunteers, and we just have a conversation with people. You could do blood tests, you could do blood pressure tests. You could just do some initial conversations with us to build up their confidence, and then we can help you make referrals as well. So I was down the Hippodrome, and outside the Hippodrome there were 3 vehicles, double-decker bus where people could, for cancer awareness. There was another truck that people could do screening for liver cancer, and then we had voluntary sector organisations ranging from drugs, alcohol projects as well. So this is it, and we want to build on doing more of that kind of work, and I think. That's why I think we want to eventually work more with the corporates, especially some of the pharmaceutical companies, because we give loads of money to them, as you know, and we want them to be more involved because it helps them in the medication process. Because if people aren't taking the medication, don't know how to take the medication, but we can help them around the awareness and what they need to do. That's one thing, but also it's about that public health intervention as well. So that's important. But we worked with a number of voluntary sector organisations. So the Chinese charity community association, which is based around the corner. I've been there a couple of times. So they were there, and actually some of their volunteers came along to help out throughout the whole day, which was brilliant. With Health Watch down there as well. We had Macmillan Cancer Charity and other organisations that were there. So we're trying to harness not just voluntary organisations, but individuals as volunteers to be part of this process as well.
That's amazing. That's amazing, because it talks about all the brilliant things about programmes that work.
Yes.
Community involvement, actually seeing people who are from the community that you want to get involved. Having the specialists there, so people and services who you might think, if you're from that community, actually those services aren't for us. Just having that kind of trusted conduit to make it more accessible. That's just fantastic.
And we've run this. We want to do more of this stuff, and I think this is where social value comes into action, because if it can save someone's life, or if someone said, "I'm going to go now, sort myself out and see a doctor," that can make a big difference. It really can do.
Absolutely, and I think that's really important, is it? Because those are the kinds of interventions that will shift that 10-year lifespan gap. And actually that is where social value can really come into its own.
Yeah.
So how we're at the beginning of this journey.
Yeah.
How are you measuring social value and how effective and successful this whole programme will be?
It's still early days. So in terms of our governance structure, we've got about 4 or 5 committees, subcommittees of the main board. One of our subcommittees is our sort of health and equalities social value committee. We called it around that, and that's chaired by Afzal Hussain, who's well known in Birmingham, and he's chief executive of Whitton Lodge, and so he's very keen about the work of social value. So essentially, Simon reports in to that committee. We have regular reports about what's happening. It goes up to board. So the board is cited on this work. That's the first thing. And we've developed a very complex set of range of indicators and outcome measurements around how we measure health inequalities in conjunction with public health in Birmingham and Solihull. So that is going to be our longitudinal measurement. But obviously in the short term, it's about how we measure how many corporates sign up, what have they done, how many voluntary organisations have signed up, and then having some case studies and some examples of the work as well. I mean, one of the things that we are looking at, I'm not quite sure, I've got the details, but I think we might want to look at the whole stuff around evaluation. So that would be quite a good way of how we can measure the evaluation of the impact of social value. Because if it's working, it's great, but then we can develop it a bit more, tweak it a bit more as well. So it's still very early days around that work, but I think we're quite ambitious in what we want to do.
Brilliant.
Yeah.
What innovations are happening within this space, either within the procurement space or within some of the work that corporates were already doing that could be further platformed?
So I think it's, I wouldn't say innovations, it's just doing the basics. I have to say, it's just doing the basics, you know, in terms of, like, for example, using the portal that we've got just to get people to register on there. It's about like I said, Simon Clark is going around visiting lots of organisations to do that awareness raising. So it's just getting the basics, and then once we've got that, I mean, there are some potential. If Simon was here, he probably could go in greater detail on some of the conversations he's been having with corporates and with the voluntary sector. So I've not had access to all of that as well. But I know when I got an email heard from him, and then just last week actually, to say that we as ICS system has been shortlisted for an award, and he's been shortlisted as a leader for as well. So we've been shortlisted for 2 major awards. So I think that tells you that we're on the right tracks. But I think if we get the basics right, then you can start looking at whole stuff around transformation. We've got a transformation program already for the NHS and how we want to develop our work around neighbourhood health management, working, bringing together all aspects of the NHS family to stop people going into A&E. Because most 30% of people, or even more, don't need to go to A&E, but all people automatically default to A&E. So if we can make sure there are more services close to people's homes and is integrated, then that will take the pressure away from A&E. So, and I think eventually social value could add value to that as well. Yeah. So we're just doing lots of stuff around our own strategies around transformation, around healthcare delivery, and as well as trying to support the voluntary sector in a very tight financial situation. So that's reality. We're lucky. We're not lucky. We've worked really hard for the last 3 years. We've balanced our books as NHS in Birmingham Solihull. We're one of the very few systems in the country to actually have balanced our books. But we've balanced our books, but we still are committed to this work as well. So that demonstrates to you how we've tried to. That's transformational in its own right, to balance your books and do something different at the same time.
Amazing. How have you achieved that?
You'll have to talk to the accountants. But we've done it. But unfortunately, it means that some of the things that we would like to do, we can't do because of the challenging financial constraints that the NHS is facing.
But it's great that within that environment, within that context, that you still have a focus on social value.
Yes.
And you still recognise the strength of the voluntary sector,
yes,
enabling you,
yes,
to be able to achieve some of these goals. So for you, what is your long-term vision for the change that could happen because of incorporating social value and embedding social value?
Well, I think we want it part of the DNA. So we've already started that already. Like I said, we've already built that into our procurement process already. But it's more about how we build that into the DNA of the rest of the NHS family. So we think about social value all the time. It's not just seen just as a procurement activity. It's a much wider agenda which fits into our agenda around health inequalities, tackling discrimination, inequalities as well. So we've got a good foundation base. ICBs are changing. As you probably know, the government's have abolished NHS, going to abolish NHS England, and also at the same time we have to make further reductions in the way that we are in our running costs. So that has meant that because of those two factors, we are now exploring with neighbouring ICBs how we work better together. Where I think we're the only ones that's doing social value in this way. I hope that we can influence the other ICBs in the West Midlands to also take forward the work around social value, and then you have even a bigger footprint around how social value can really work.
And that's amazing to see, because actually if you've done all of the work
Yeah.
in creating the frameworks,
Yes.
testing how
Yes.
you can bring together some
Yeah.
of these partners, then absolutely
Yeah.
why not collaborate with neighbouring ICBs to
Yeah.
share that same information?
Yes.
Brilliant.
So I think that's one thing I could see definitely happening. Yeah.
Amazing. So Patrick, what does social value mean to you personally? Why does it matter to you?
It matters to me because I've had various jobs. I've worked in the voluntary sector. I've been a civil servant, and I've been a politician. So I see social value. Social value is not just social value. If you look at the history of social value, it's about social justice. We've just corporatised it to call it social value because it's easy to transactionally do it with corporates. But it's actually, if you look at it, it's actually social justice. So the big issues that affect communities: poverty, racism, sexism, discrimination, inequalities, barriers in the job market, barriers in the housing market. That is social justice, and social value is a kind of business contractual way of actually getting corporates and the NHS to do some more of that work in a safe space, essentially. But out there in the wider community and wider society, it's a big issue, and so we still have to fight for inequality and social justice. And one way is actually how we use our money, taxpayers' money, to over and above the stuff that we do anyway as taxpayers, right, funding a whole range of activities around tackling health inequalities and social justice. How we use our NHS, how we use our money contractually to get corporates and other organisations on board as well. And also it kind of helps. The funding models for the voluntary sector have changed over the years, as you know, and the days of grants are fast disappearing. There still will be grants, and lots of philanthropists and funders have stepped into that space. And I think corporates have done their bit, but they could further step in that space too, and that provides opportunity as well.
Yeah, absolutely. And I think just being targeted, like you talk about the data that you have, making it more focused and making it really place-based.
Yes.
Where actually you can, by focusing on a particular community, a particular area, you can actually make a real difference to their life chances and their life outcomes. And I think, where you can have that collaborative partnership between corporates, the voluntary sector, that community, and the NHS, that's where that real change can happen. And that's where it can really make that shift for the long term as well.
No.
Patrick, thank you so much for your time. I really appreciate you joining us on the podcast.
No problem at all.